Hi, I'm going to talk to you today about preparing for bariatric surgery at Community Medical Center and Monmouth Medical Center. Important reminders: please have your favorite protein shake, sugar-free ice pops, and low-sodium broths ready. No straws, this will cause you to swallow air, causing gas pains. No smoking, and this includes vaping. You will be tested for nicotine prior to surgery, and positive results could potentially cancel it. No carbonated beverages, including soda. This can cause a potential leak. And no caffeinated products, as caffeine is a diuretic, which makes you urinate more frequently, and we want you to stay as hydrated as possible after surgery. Medications before surgery that should be stopped include blood thinners or antiplatelets such as aspirin, Xarelto, Coumadin, non-steroidal anti-inflammatories such as ibuprofen, naproxen, Motrin. You can use Tylenol as a replacement, and GLP-1 receptors such as Ozempic and Wegovy and Zepbound, and birth control. After surgery, you should have no problem swallowing whole pills. We recommend taking one pill at a time every 15 minutes with a sip of water. Medications will be called into your pharmacy before surgery. There will be an antacid to prevent heartburn, a medicine to prevent nausea, and pain medication to take as needed. Over-the-counter medication to pick up, we do recommend Gas-X to help with post-surgery gas pains, stool softeners, and those examples are Colace. Preparing for an early recovery. During your pre-admission testing appointment, you will be given one bottle of Ensure pre-surgery drink. This drink provides complex carbohydrates and helps provide energy, promote hydration, and helps you to feel better after surgery. If you're diabetic, you will drink that the evening before surgery at bedtime. And if you are not diabetic, you will drink the bottle the morning of surgery as soon as you wake up or 1 hour before you leave your home. We recommend drinking those bottles in less than 15 minutes. You may also take 2 extra strength Tylenol the night before surgery. After surgery, you will recover in the post-anesthesia care unit. You may be given a sugar-free lozenge. You will be moved to our designated bariatric unit. Once you're there, your family can visit you. We do recommend coughing and deep breathing exercises, which is so important for your recovery. Walking, and just make sure you use the call bell to notify your nurse when you're ready to get moving. And please note, due to receiving anesthesia and pain medication, you are considered at risk for falls, so you should call for assistance when getting up. Equipment you may see during your hospital stay: heart monitor, incentive spirometer, compression boots, IV fluids. There may be an alarm on your bed, and the medicine cups. To prevent potential complications, we do give medication that thins the blood at the time of surgery. We do use compression boots, and we do recommend early ambulation to prevent infection. We will give you an antibiotic at the time of surgery. Make sure you keep your hands clean and don't pick at your incisions. To prevent any respiratory issues, we do recommend that you cough, deep breathe, use your incentive spirometer, and walk around. So your goal should be frequent walks. This helps promote bowel movements and prevents blood clots. Deep breathing exercises using the incentive spirometer. Tolerating your clear liquids. We want you to sip fluids 1 ounce every 15 minutes while awake. Continue these goals when you get home as well. Please follow the diet guidebook. No lifting over 10 pounds. And you may drive once you're off your pain medication. If you are having any of the following issues, please call our office. That would be a fever over 100.5, any redness, warmth, foul-smelling drainage from your incision sites, any worsening pain or changes in your pain, no bowel movements after 5 or 6 days, and vomiting. The after hours, weekends, and holiday calls for the particular doctors are listed below. We do recommend going to the nearest emergency room or calling 911 if you're having any difficulty breathing, dizziness, or confusion. As a last reminder, clear liquids. Please start slow, drink slow, take small sips. We do recommend 1 ounce every 15 minutes. By the time you leave the hospital, you should be able to tolerate at least 3 to 4 ounces per hour. Continue to drink as much as you can tolerate throughout the day. Keep yourself hydrated. Some signs and symptoms to look out for of dehydration may be dark urine, thirst, decreased urination, dry mouth and lips, sunken eyes, tiredness, and possibly a rapid heartbeat. Please follow your dietary guidebook. And remember, any questions, you always can call the office and speak with a dietitian or nurse. The last reminder, and it is very important, is to follow up with your doctors, including primary care, endocrinologist, and cardiologist for medication management. Thank you for listening to this important preparing for surgery video.